Today, we're diving into a condition that starts with something almost everyone has experienced, but can lead to something truly serious. We're going to talk about rheumatic fever.
It sounds a little crazy, right? I mean, how on earth can a regular old sore throat, something you get over in a few days, actually end up damaging your heart? Well, that is the exact question we're going to answer. Let's get into it. So to really get this, we have to start at the very beginning. What exactly are we dealing with? What's the spark that lights this fire?
Okay, so at its heart, rheumatic fever is what's called an inflammatory autoimmune disease. The key thing to get is that it doesn't just appear. It's a complication, a really serious, though thankfully rare, follow-up to an untreated strep throat. And it seems like it takes a perfect storm to happen. You need that untreated infection, plus the person has to have a specific genetic makeup. It's not just bad luck, it's bad luck hitting the wrong person at the wrong time.
So who's most likely to get it? Well, anyone can get strep throat, but rheumatic fever, that mostly hits children and teenagers. We're talking about this 5 to 15-year-old age group, which is exactly why taking those early sore throats seriously is so important. So how does the body go from fighting a normal infection to turning on itself? Well, this next part is all about a really dangerous case of mistaken identity, a kind of betrayal from our own immune system.
And this is the core of the problem. It's a concept called molecular mimicry. Just think about it like this. Your immune system builds these incredible soldiers, antibodies, to hunt down the strep bacteria. But the bacteria is clever. Its disguise looks almost identical to some of your own healthy body parts. So even after the bacteria is long gone, these confused soldiers stay on high alert and start attacking your own body. It's basically a tragic case of friendly fire.
And this friendly fire isn't random. Oh no. The antibodies have very specific targets. And that's why rheumatic fever causes such a mess of problems all over the body. You get inflammation in the heart, super painful joints, weird rashes on the skin, and even issues that affect the brain.
With all these potential symptoms, how do doctors actually figure out what's going on? This is where it gets really interesting. They basically become detectives, using the specific checklist of clues called the Jones criteria. Let's take a look at how they read the signs.
So the criteria are split into two groups. You can think of the major criteria as the smoking guns. These are the really distinct, telltale signs of the disease. And then the minor criteria are more like supporting evidence. They're not as specific, but they definitely help build the case.
Let's look at the majors. First, and the most serious, is carditis. That's inflammation of the heart itself. Then you have migratory polyarthritis, which is just a fancy name for really bad joint pain that moves around. One day it's a knee, the next it's an elbow. Sydenham chorea can be pretty scary. It causes these jerky, uncontrollable movements. And finally, there are two classic skin signs, a very specific ring-like rash and these little painless lumps you can feel under the skin.
And here are the minors, the supporting clues. This includes stuff you'd probably expect, like a fever or just general joint pain. But it also includes things only lab tests can find, like signs of inflammation in the blood or a specific change in the heart's rhythm on an ECG. A doctor needs just the right mix of these major and minor signs to be sure about the diagnosis.
But wait, there's one last crucial piece of the puzzle. The doctor has to find proof of the original culprit, that group A strep infection. Without a positive test, the diagnosis just can't be confirmed.
Okay, so the diagnosis is confirmed. What's the game plan? Let's get into the treatment playbook and see how medicine launches its counterattack.
The strategy here is, brilliantly logical. It has three main goals. First, you get rid of any bacteria that are still hanging around using antibiotics. Second, you calm down the body's crazy overreaction with anti-inflammatory drugs. And third, and this is arguably the most critical part for the future, you prevent it from ever happening again. That often means taking antibiotics for years, because every single time you get strep again, it can restart this whole autoimmune nightmare and do even more damage to the heart. So we've gone over the cause, the diagnosis, the treatment, but what's the end game? Why is catching this so critical? It really all comes down to the long game.
And this right here is the whole point. Everything we've talked about, it's all aimed at stopping one thing, chronic rheumatic heart disease. This is the permanent damage, especially to the heart valves, that can happen because of all that inflammation. This is the truly heartbreaking consequence that all started with a simple sore throat.
All right, let's just boil this all down. Rheumatic fever is your body's immune system getting confused after an untreated strep throat. Doctors use a special checklist, the Jones criteria, to diagnose it. The treatment is a three-part plan: kill the germs, calm the inflammation, and stop it from coming back. But honestly, the single most important lesson in all of this? Get that sore throat checked out. Treat strep throat.